We have been lied to. I wish I could say this is a preventative care system, but this is a sick care system, right? This is a system that wants you to be sick, is okay with you being sick, and it's up to you, right, to get over this basis of a system to make sure you're the healthiest you can be. That's why I think they put doctors like me here, right? Because we understand that the status quo, right? If we just let the system do what the system does, there are going to be much more sicker people than healthier people, right? Like that's just, I think, the reality at hand. And if we, right, we as a provider, we as the patient aren't ready to acknowledge that, I don't know what to tell you. Again, I'm yours truly, Dr. Barry Pierre. I'm the host of Medicine Mondays, board certified internist. And today we're going to be talking about what preventative care really means, right? We're going to talk about what preventative care really means. And by the end of this video, I hope that I can help you or a loved one stop falling through the cracks of this healthcare system because the preventative care, or what you're supposed to be doing in regards to preventative care, just isn't preventing anything. All right, so let's talk about the problem. Let's talk about the problem at hand, y'all. So preventative care. Most people think just going to the doctor for a regular checkup is preventative care. Job is done, right? Like, see you next year, right? That's what most people think when it comes to preventative care. But I like this definition. Preventative care means stopping diseases before it ever starts. Stopping diseases before it ever starts. But unfortunately, the way our system is at hand and currently constructed, that doesn't happen, right? Y'all know that, and I know that, right? That just does not happen unless you are aggressive in making sure it doesn't happen. So imagine you have to be more aggressive in preventative care than it is when you're actually sick. You think I don't understand that? Do you don't think you know that? Right? When you want to go to the emergency room, guess what? They'll put a timer to say, hey, you know what? We're only 3 minutes, 4 minute wait. We're emergency room. All gas, no brakes when it comes to when you're in that emergency room, especially after they, to the triage and they realize like, all right, you're not that sick, right? You get in quick. But if you wanted to try to go call your primary care provider, say, hey, can I come tomorrow? I got to, oh, I'm sorry, I'm booked. Oh, I'm sorry, I'll see you in 2 months, right? Hopefully exaggerating, right? But like you kind of get to the point, right? I want to go see my regular doctor, just to do my regular checkup, get, see what's everything going on. All right, let me let you know when the next appointment is. Yeah, we probably got something in 2 weeks, 3 weeks for you. Versus I'm sick right now. I'm hurting right now. I'm going to go to this building called the emergency room and I'm going to get it addressed right now. So again, we have a system that does not necessarily favor those who are trying to be preventative in their care, but definitely favor those who are like have an acute issue that needs to get taken care of. So these are some stats. These are some numbers, right? CDC surveys show that only 8% of Americans get all of their recommended preventative services. So y'all are going to your doctor's office, you're having conversations with your doctor, and over 90% of the people are walking out of there not realizing that it's preventative services that they should be getting, right? Or they do realize it and they didn't understand it, or they do realize that they didn't care because the doctor didn't stress enough. Over 90%. Again, that includes screenings, vaccines, lifestyle accommodations. And understand that 2.9% of healthcare dollars is spent on prevention. 2.9%. Let's just say 3. We'll give it a rounding error and say 3. 3% of the healthcare dollars, or the dollars being spent regarding healthcare, is spent on the preventative side. The rest of it's spent on treating that acute disease, right? That's why I brought that example with the emergency room, right? You want to go see your doctor for your regular checkup, see you in a few weeks. You got that emergency problem, I'm gonna take care of it right now, right? And you kind of see where the balance, right, is tipped. The balance gets tipped, right? Because like I'm only, again, I'm showing it with my money. I'm only going and taking care of the acute stuff, not taking care of the chronic stuff, the preventative stuff. To the point where they have to continuously incentivize doctors to get into outpatient medicine, to get into primary care medicine, right? To do all these preventative things, right? Because so many people weren't doing it, right? They're like, all right, we got to pay more. Like we just gotta pay more, and if us paying more, now mind you, when they raised the reimbursement rates on preventative care, they took it from somebody else. So and that's a whole different boogeyman we could talk about later. The boogeyman, the administration side says, hey, you know what? You guys have a small pie. I'm gonna just take a little bit of your pie over here. I'm gonna give it to them. I don't want you touching my feast that I have on my table over here. I'm just gonna divvy up this little money that I put on the side for y'all. Right? That is how healthcare gets treated. That is how preventative care gets treated, but not today. Right? So let's ask ourselves, right? And I like this question. Why aren't we getting the preventative tools? And what can we do today to make sure that doesn't happen? Right? What can we do today to make sure that all the preventative tools that I need, I get? Let's think about it and let's talk about it today. All right. So I've had these conversations, especially like I said, let's go down memory lane. Let's talk about when I was a resident and I was taking care of, and I've talked about this lady before, right? I was taking care of a person who, first time seeing me and, just needed, wanted to do a regular checkup, hadn't seen a doctor in years, right? That's always a sign. It's always a sign when they haven't seen a doctor in years. I'm like, oh, okay, no problem. I'm listening. And, during my exam and during my physical, I could tell she was kind of, uncomfortable, especially when I just went to go listen, right? Just to go listen. I was like, So, after, going through my spiel, I said, hey, you know what? You're at the age where, you should get that mammogram. You should get this done. You should get that done. Like I did my thing, right? Pretty good at what I do. I did my thing. And she was like, Doc, yeah, I might need to see the surgeon. Like, I think we could probably skip, having to go see, the obstetrician to get a mammogram. Because like, yeah, I probably got something. I'm like, what do you mean? And when I tell you, she had developed this cancerous tumor that was so large that it broke the skin. And so there was no confusion about whether this was cancer or not. That looked like cancer. I'm like, how long do you have this? She's like, yeah, a few years, right? And that probably wasn't the real truth, right? Because the size of that mass that broke the skin was so troubling. So of course I have to keep my game face on. I keep my game face on, y'all. I keep my game face, even though I wanted to scream on the inside. I definitely was screaming on the inside. I can tell you, because it was, again, probably within my first year of practicing medicine as a residency, I was screaming on the inside. And, I just, we had a surgeon upstairs, we did all the things we needed to do, to get her taken care of. But that's what happens, right? That's what happens when you don't have the preventative care, when you don't have someone in your ear saying, hey, you should get that mammogram. You should get that colonoscopy, right? When you don't have someone doing those things, the end results will always occur, right? And I think a lot of people think that if I don't get the colonoscopy, nothing will happen. Like if I don't know, I just don't know. No. You'll eventually come to see a person like me in the ER because you just say, you know what? I'll just let it go by. I'm not going to pay it no mind, right? And because you didn't pay it no mind, it kept doing what it's doing. So eventually you see the doctor one way or the other. It's always easier, I say, to see them in the beginning than to see them at the end, because it costs more at the end to see them than it typically does in the beginning, right? Here or there. So let's talk about, this understanding of, like, how do we get to the point, and then make sure you hit the like, make sure you hit the subscribe button. How do you get to the point where you and your family don't have to worry about falling through the cracks of this preventative care system, AKA the sick care system? Like, how do we get to this point here? Let's talk about it. All right. So this is a little bit of truth. I gotta say, there's a little bit of truth. I gotta say, preventative care isn't just blood tests and putting your stethoscope on your patient, right? And I can tell you, since this pandemic, a lot of y'all doctors are not doing good physical exams. Let's just throw it all out there, right? A lot of doctors are not doing very good physical exams. I'm watching doctors who don't even have the stethoscope near their name, like no stethoscope in sight. I'm looking like, I'm like, how are they going to listen to the heart and lungs? How are they going to do the normal physical exam? How are they going to listen to the belly, right? No stethoscope in sight. So understand that just having, just going to the doctor's office, just doing some blood tests isn't about the preventive care. Like that's not where it starts and stops, right? Like there are a whole bunch of things you got to do. We're going to talk about it. And these are just steps and strategies that I want you to employ. Make sure you write this down. Number one, know your screenings by age and gender. Now, understanding that when you are at 40, there's certain screenings you get. When you're at 50, there's certain screenings you get. When you're at 65, there's certain screenings you get. You got to know that. Now, I can tell you most doctors, more importantly, most of these electronic medical records, they do a lot of that for you. Because they're like, hey, doc, the person's 40 years old, you should be recommending, like they'll do a good job. But if for some reason you don't have some good EMR like that, you have to know it yourself. And as the provider, as the patient, you got to know that, hey, I'm getting close to the age where I should be getting a colonoscopy. Why didn't I get my colonoscopy? What's up with my mammogram? Like you have to be just as informed when it's your time to get these things than the other. Because again, your doctor may slip up. Your doctor may slip up and forget. But we don't want them forgetting when it comes to our health. We just don't, right? Like that cannot be the case here. So number one, know your screenings by age and gender. Number two, remember vaccines count as prevention. I don't care what these anti-vaxxers are telling you online. Because remember, these are the same anti-vaxxers who are telling you that everyone who took the COVID vaccine would be glowing in the dark or we'd all like drop dead randomly someday. We're still here. We're still here alive and kicking. Right. So don't listen to non-experts, especially now that we got a non-expert as our health and human services. Another conversation. Remember, lifestyle is a medicine. Number three, lifestyle is a medicine. So understand that when it comes to, like weight control and diabetes and everything else, you got to make sure you have a good, appropriate lifestyle management in check to get you to where you need to get to. Right. So I think that's an important question. And always get the family's information. I can't tell you how many times I'm talking to a patient and they have no clue what's going on in their family. No clue, right? And why is that a problem, Dr. Pierre, is what you may be asking. Dr. Pierre, why is that a problem? Because there are so many disease courses that when we're screening, we screen for one age. But if we know you got a family history of it, we screen for a different age, right? Like we start a little bit earlier, right? Chadwick Boseman wasn't even 40 years old when he passed away, right? Like the likelihood that he did not have a family member who had colon cancer is so low to me that I don't even entertain it. I don't entertain it, right? Because he was under 40 years old. We typically don't even do colonoscopies until they get 40. He had advanced stage colon cancer by, I think it was like 34, 35, right? Which means we would have had to check him around the age of 30, right? So I would have loved to know if there was a family history of colon cancer in his family that would have precluded us to know, yeah, you better get checked early. You better get checked early, right? So understand, right? And again, remember, if any of those strategies like hit a light bulb on you, make sure you hit the like and follow and subscribe for more, right? Shout out to that from that standpoint here. So what I wanted to do, man, and I think I say this like once a week, right? But we can't keep listening to people who are just not informed. We cannot listen to people who are not informed, not educated. And I don't care if they try to make being educated a bad thing, right? You're not going to take that away from me. And I understand that a lot of it is likely going to be more jealousy based and reality based anyway. So like, why would I give it any kudos? Right? Why would I give it any kudos? So yes, understand when we talk about, all of these, preventative measures, vaccines in particular, lifestyle medicine in particular, getting your screening exams in particular. There isn't necessarily a hierarchy of sort. But what you should know is that if you're going to get your information on what things you should do, please get it from someone who's reputable in the medical community, a professional, right, who understands the consequences of you not doing it. Right. Because what tends to happen on social media is that y'all will listen and hear somebody say something. You will follow the actions of the person who said it. But when something happens, you want to start looking back and say, "Hey, why didn't you tell me?" No. I told you what to do, and you said, "I'm gonna listen to this blogger who I like their views, and I'm just gonna listen to what the blogger says." Right? Neither here or there. Neither here or there. So before we get up out of here, understand. When we think about preventative care, preventative care is a proactive approach, right, to just doing the status quo. We can't do the status quo. Status quo is going to have a lot of us sick, unhealthy, dying early. We're not doing the status quo. When we talk about preventative care, we are as aggressive in getting our preventative care done as we should when we have a heart attack and we have a stroke and we got to go to the hospital. We should be that aggressive when it comes to that aspect of care, right? Preventative care, extremely important. We do not want to be in that subset group, right? Right, who are dying from disease they should never be dying from, right? Who are developing disease they should never be developing, especially at a later stage, right? We are at that point where that shouldn't happen. It does, and it's because our system is perfectly made that way, right? And if you follow yours truly, Dr. Barry, I'm here to make sure that we make sure we're going to navigate. We're going to break that old system of old and introduce it to a system where, you know what, primary care, preventative care is priority, is number one, should get paid the most. Your patients should get the most services, right? Like, we're going to make sure that occurs when it comes to this grand scheme of things, right? Because if you don't, bad things can happen. So again, I'm your truly Dr. Barry Pierre, and I'm gonna see you guys next week.